Welcome to Advancing Health. Tending to the overall well-being of a patient often has emotional and spiritual dimensions as well as medical. In today's podcast, we hear from two experts about how chaplains are helping people of all backgrounds in the healthcare setting as part of an interdisciplinary team, making sure care is focused on the whole person.
I'm Elisa Despagochaga, Vice President of Clinical Affairs and Workforce at the AHA. Today, I'm joined by Jason Lesandrini, AVP of Ethics, Advanced Care Planning, Spiritual Health, and Language Access Services at Wellstar Health System, and Kelsey White, Assistant Professor and Chaplaincy Faculty Researcher in the Department of Patient Counseling at Virginia Commonwealth University. And this is a discussion I've been looking forward to for a little while. We're here to really discuss how they have worked to integrate chaplains into well-being programs in healthcare and really make those connections across both their research and their organization. So to start off, Kelsey, why don't you start? Just tell us a little bit about the work that you do and who you are.
Yeah, thanks for having me. I'm a professor primarily these days, but my career started out as a board-certified chaplain working in outpatient, a very large outpatient center, as well as oncology. Fell in love with chaplaincy to the extent that I wanted to figure out how to do research about it. And from there, went to do a Ph.D. and really focus on expanding the research and the integration of chaplains in my efforts.
And I'm guessing that's how you got to meet Jason. Jason, can you tell us a little bit about your work?
Thank you. Thank you both for being with me today. So, like you said, I work at Wellstar Health System, which is a large integrated healthcare system in Georgia. Been here for about 10 years. And really, my focus of the work I was doing originally when I came was on ethics. That's where my background is. I'm a PhD in healthcare ethics from Duquesne and spent a number of years at another local system doing ethics work. And as I got here to Wellstar, noticed there was a need sort of in conversations with the executives to really take spiritual health as a team and have an executive representative. And so I've been doing that 8 years now is what we're going on. So I'm really excited for it.
Kelsey, just to level set with our audience, can you describe a little bit the role of a chaplain within a healthcare organization? I think everyone may have a little bit of an idea, but not fully understand what that role means today.
Yeah, absolutely. So to kind of step back, they aren't just the folks that go in and pray, but really they're members of the interdisciplinary team who really help make sure that the healthcare that we provide is focused on a whole person. So they typically have a graduate level of education, clinical training, over a year of clinical training typically, board certification or certified eligible. And then they have this expertise to attend to individuals' emotional, spiritual, and that interpersonal well-being. So they are trained typically to talk to all people, whether it be staff or patients or family members, about spirituality, but not just what we think of as this like religious type of topic when it comes to spirituality, but spirituality really encompasses the way we make meaning of the world around us, how we find purpose and connection, and then to deal with kind of the tough things that happen in our life that make us ask why. And so chaplains are trained to really have those tough questions, but also to really support folks in really difficult situations.
As I usually say, one of the challenges and opportunities in healthcare is that we are with people at what may be some of the most difficult moments in their lives. And so being able to not only support their physical health, but in their mental health, but their emotional health and their ability to connect with them and support them as they wrestle with some of those questions, I think is key.
Yeah, and I'll also add, like, because of the extensive training they've had, they're equipped to work with people from all different backgrounds and regardless of faith tradition. And I think they're really touching on these like core existential topics that are just part of everyone's natural being. And that when those things are out of whack, they can end up impacting one's health too.
Jason, how are you actually incorporating this amazing set of skills and resources and humans in your organization into well-being initiatives? And, Kelsey, I'm sure you have ideas as well.
Yeah, so it's a great question. Kelsey definitely has a lot to share about this as being a chaplain, not being a chaplain, but leading chaplains. I get to see the great work that they do. And I think here at my own organization, we have a program called CARES. It's an acronym that basically it's a sort of a response system that when sort of some type of critical incident happens, our chaplains are available 24 hours a day, 7 days a week, 365 days out of the year. No holidays, no breaks, no nothing. They are there to respond. The chaplain is the first person who gets that call. And the beautiful thing about our chaplaincy program is that our spiritual care providers are on the ground, right? We're not on a telecenter responding to our team. We're actually on the ground and can be with another person, which we think is really important to sort of staff's overall well-being. Now, how you get in touch with them, of course, is electronically, but it's that physical presence that we think is important. To Kelsey's point earlier about how do you care for this person? That's you care for them in the moment with them and to be by their side. And so our team, this is one big thing that we've been pushing is our team is there for others when they need them during those critical times.
At VCU, we do a whole lot of different things. I like to think about them in kind of two buckets. So we've got like chaplain efforts that really focus on in real time reducing stress levels, helping manage distressing situations, whether it be debriefing or giving them a moment of respite. So some people have heard of like tea for the soul or chi carts, where chaplains will push them around and offer clinicians these moments to just breathe and to be reminded that they're cared for and that they're supported and that they're not alone. And sometimes that can make a big difference in a busy day. And then there's this other group of ways in which chaplains, I think, can really impact well-being is thinking about a specific way that a chaplain can alter a workflow or a process that really shifts the burden off of other clinicians. So a really concrete example of this is a program that was actually developed here at VCU called the Family Communication Coordinator. And this intervention is really focused on those individuals that qualify to donate an organ. And so the chaplain comes in and to relieve some of the stress on the nurses and the physicians and the clinical team will facilitate the process between the family and the organ procurement organization, which really can just, I mean, decreases stress, decreases role ambiguity, and helps kind of minimize all of the things that can be exacerbated in those moments.
I think that's so key. One of the challenges we keep seeing broadly in the workforce space is that need to unburden some of our team members from having to do all of the things. And how can we find those roles that and those activities that don't require a physician or a nurse to be doing it, but someone has to be part of the health system and be able to provide that support. So I love the idea of taking advantage of that amazing set of skills and connections and really bringing them to bear on what has got to be one of those difficult times.
Yeah, and they're actually I talked to some chaplains, recently who were part of their organization's efforts to assess for, the social determinants of health, and that could be done by a lot of people. There's something about the way in which a chaplain's able to build that trusting relationship that not only helps with the specific process, but it's one less thing that the nurse has to screen for or attend to. But also, those chaplains have the skills to get at really sensitive topics for patients and families.
Jason, talk to me a little bit about how you're connecting this great work, not only to make it available to your patients, but to the organization's mission and overall well-being for your team, for those who are doing the caring.
Yeah, so here at Wellstar, our mission is to enhance the health and well-being of every person we serve, and we're focused on something called people care, which is about providing care that's unique to whoever. So it's Kelsey care, it's Jason care, it's all of our care. And look, I know this sounds silly, but I can't think of anything more people focused than thinking about how individuals deal with mind, body, and spirit, right? And thinking about what are those individuals who have expertise in that space and some of the spaces that we often forget of to sort of attune to that. And so while most of our work tends to focus on patients and their families at the bedside, there's also this other side of people care, which is about the people who care for the people care. And so, we need to think a lot broader about this. Kelsey's earlier comments made me think of, something that's really fascinating about working with chaplains. Sometimes it's just about being there. So yes, the issue might be called up because of, a family or a patient maybe having some spiritual distress or something that's going on. But I'll tell you that the beautiful thing is when you just watch it happen, it doesn't have to be anything magical. It's Kelsey as a chaplain coming to my bedside or talking with the patient and family. And then what do? They go out to the nurse's station or they see the doctor who's documenting, in the chart or whatever it may be, or the EVS worker, and just being with them. I think that means a lot. And so when I think about how we focus on people care here and how we care for the people who care for the people that we care about, that we're trying to tune to, I can't think of anything more connected than sort of the great work that our spiritual care providers do across the entire enterprise.
It's just so heartwarming to see the taking that moment because I mean, healthcare is a hard place to be. It's a hard place to work, but it's one that is so rewarding. And so, hearing the opportunity that the chaplains can take to really sort of reground everyone in that work. Kelsey, let me ask you. I've got sort of two options here. One, share a story about something that surprised you as you've been involving chaplains in this work, or otherwise, it may actually be both. Advice you'd give to other organizations who are looking to tap into their chaplaincy programs to support well-being. And then, Jason, I'll ask you the same thing.
The thing that I think surprises me the most when I have conversations with folks across the country is this level of innovation that chaplains are really living into in these efforts. They recognize the highly specific nature of the stress and distress they see and can adapt in a way that focuses on their localized context. So, if there is a certain challenge that is very perhaps it was a community shooting, right? So the chaplain able to really adapt and address those tensions that are arising right there and how that affected the clinicians because they're part of the community too, right? They're not just there at the hospital, but they live there. And then I'd also add just the way in which chaplains care for the employees in the like the outskirts of healthcare institutions. So there's stories about chaplains caring for security workers, teaching them how to be resilient, teaching them how to cope with intense situations, or teaching community health workers how to engage in authentic conversation. Jason talked some about just being there. And I would even take it a step further. And there's something about being both physically available and emotionally available that is not unique in our everyday relationships.
I think the most surprising thing that I know in the work with chaplains is this misnomer about chaplains coming to pray. So Kelsey talked a lot about this. When I've asked my colleagues across the country about it, that's what they tell me that, well, we call the chaplain to come in and pray. And I just think that's selling them short, just really short of the work and scope. We're all trying to work together every day to operate to the fullest extent of our capabilities because everyone in healthcare needs it. So I think just thinking about chaplains as folks who come up and pray with people is just way too narrow. They can do that, but man, they can do so much more if we just open the door. I live by this principle about being a helper. I think they're helpers. I think that's what they actually are. And they can help people across the spectrum, the religious, the non-religious, the spiritual, the non-spiritual. My experience has shown me that spiritual care providers are probably some of the best listeners. And man, I can tell you this, I need an ear more frequently than I'd like to admit. It's not a judgment, it's not a religious context, or it's just a really good listener. Your second point, Elizabeth, maybe I could just chime in here because I got lots to say, and people who know me across the country know that I have a hard time being quiet. So I'll say this about advice to other organizations. You had mentioned that. I think the biggest piece of advice I'd give other folks is, man, please just ask them. That's the biggest piece of advice is ask them for help. I think that's the biggest problem we have across this country is that spiritual care providers, chaplains, all these folks who sit in this space are not being asked to assist with this work. And wow, if they are, the evidence is just not even, you can't doubt it. That they can help, but they got to ask. You got to ask them. And we have to, we're doing work on this on the other side is we got to have the chaplains and folks speak up. That's the other piece. You got to speak up. So we need to ask, you got to ask them, what's the work that they can do? What can they do? And then hold them accountable for it. Because I think that's part of the value that chaplains can do is the literature's clear. They can help. You got to ask them to do it and then just hold them to it because it will come out. I promise you.
Jason and Kelsey, thank you so much for joining me, sharing a little bit about your world. And hopefully through this podcast, we're sharing with others the opportunity, both for chaplains to raise their hands and for those around them to say, hey, you got a moment? Can I bend your ear? Because I think that is something we all need very much to get through healthcare and to be able to help others. So thank you again for joining me.
Thank you.
Well, thank you.
Thanks for listening to Advancing Health. Please subscribe and rate us 5 stars on Apple Podcasts, Spotify, or wherever you get your podcasts.